Heart attacks and strokes are two serious medical conditions that can have life-threatening consequences and are often confused due to a few overlapping symptoms. A heart attack typically presents with chest pain, shortness of breath, and discomfort in the upper body, while a stroke is characterized by sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, and difficulty speaking or understanding speech. Immediate treatment for both conditions is crucial. Heart attacks are often managed with medications, surgery, or other medical procedures to restore blood flow to the heart, whereas strokes may require clot-busting drugs, surgical intervention to remove the clot, or measures to control bleeding and reduce pressure in the brain. Recognizing and managing risk factors such as high blood pressure, smoking, obesity, and diabetes is vital for prevention and overall health improvement. Lastly, understanding individual risk factors, such as a family history of heart disease or stroke, age, and lifestyle choices, can empower people to make healthier decisions. Here's detailed aspects of heart attack and stroke symptoms, treatment, and prevention strategies that everyone should know. Affected regions. Left arm pain versus facial droop. Left arm pain often characterizes the onset of a heart attack, typically resulting from blocked coronary arteries impeding blood flow to the heart muscle, manifesting as crushing or squeezing chest pain that can radiate to the left arm, shoulder, neck, or jaw. In contrast, a stroke, involving disrupted blood supply to the brain, may lead to a sudden facial droop, specifically on one side, as the facial muscles become weak or paralyzed. Other stroke symptoms include sudden numbness or weakness, often on one side of the body, trouble speaking, vision problems, or severe headache. Recognizing these differences is critical for timely and appropriate medical interventions. Onset of symptoms. Gradual weakness versus sudden confusion. Understanding the onset of symptoms can be crucial in differentiating between a heart attack and a stroke. In the case of a heart attack, symptoms might include gradual onset of chest pain, pressure, or discomfort that may extend to the arm, shoulder, or jaw. Patients often experience this increasing discomfort over several minutes. Conversely, stroke symptoms typically present suddenly. A stroke may manifest as an abrupt loss of balance, sudden confusion, trouble speaking, or understanding speech. In addition, facial drooping, arm weakness, or sudden severe headache are telltale signs indicative of a stroke. Recognizing these distinctions enhances the timely and appropriate response, which is essential for both conditions as they are time-sensitive emergencies. Speech impairment, slurred speech versus aphasia. In distinguishing between a heart attack and a stroke, speech impairment presents a subtle clue. Slurred speech often surfaces during a heart attack, appearing gradually as discomfort in the chest heightens and anxiety sets in. Contrastingly, a stroke, particularly one affecting the left hemisphere of the brain where language is processed, can lead to aphasia, a sudden loss or alteration of the ability to speak, read, write, or comprehend language. Aphasia's hallmark is not the quality of speech, but the very fabric of communication, disrupting the formulation or interpretation of words. Hence, while both conditions might impair speech, the characteristics and onset of the impairment can signal the underlying emergency. Motor dysfunction, chest discomfort versus limb weakness. Heart attacks and strokes are both medical emergencies that require immediate attention, but they present distinct symptoms related to motor dysfunction. Chest discomfort, often characterized by pressure, squeezing, or fullness in the chest, is a hallmark of heart attack symptoms. This pain may radiate to the arm, neck, or jaw. On the other hand, a stroke often manifests through sudden limb weakness, typically on one side of the body. Patients may experience a loss of balance, lack of coordination, or sudden limpness in the face, arm, or leg, often accompanied by difficulties in speech or vision disturbances. Distinguishing these symptoms is crucial for timely and appropriate medical intervention. Associated symptoms, shortness of breath versus vision problems. When differentiating between heart attack symptoms and those of a stroke, it's crucial to hone in on the distinctive manifestations. Shortness of breath often accompanies a heart attack, signaling the heart's struggle to supply the body with vital oxygen due to blocked coronary arteries. Conversely, stroke symptoms lean towards vision problems, including sudden blurriness or loss of sight, especially if confined to one eye. This occurs because a stroke involves an interruption of blood supply to the brain, which, when affecting areas responsible for vision, precipitates these visual disturbances. Recognizing the nuances of these symptoms is key to identifying the underlying condition and seeking timely, appropriate medical intervention.